Rob, can you describe the clinical internship course for us?
So Jamie, the paramedic internship course is the final course of the program. So they've gone through all of their introduction, their skill development, their critical thinking process, and now it's time to really put all of that together and be the lead provider and providing good quality care as a student. During this course, there are several components. The first is obviously clinical. So in the field rotation with their preceptor, they are expected to lead the entire patient care experience. And the preceptor being there basically to validate it and make sure that everything goes smoothly. That includes the documentation that's included. So there is a slight change as documentation occurs for this particular course. There is a capstone form. So documentation, the expectation still continues from previous courses. Performance, again, they are serving that lead role. Some preceptors and students have related it to the clearing process in an individual operational program, where you have a provider who's there demonstrating their proficiency, being observed and documented, and then cleared at the end. And in many aspects, that is the viewpoint. As we think about the other pieces of this class, there are lab sessions on campus in the program where they are developing their testing skills to prepare them for national registry. So during this time period, a lot of preceptors always ask, what can we do? Or what's happening in the classroom that we can support? And the answer is they're preparing for national registry. So that goes back to thinking about some of the procedural, making sure that the skills are being done appropriately or in the textbook way, as well as reviewing information as it relates to critical thinking situations. A lot of times preceptors will make practice tests or ask questions about protocol or treatments to kind of help them prepare for that process. And then of course there are the other program mechanisms at the end of the program that include a competency exam with the medical director and a written test. So all of those are incorporated in the internship class, but again the focus, especially for preceptors, is supporting that independent provider status and then also utilizing that downtime to reinforce those preparation activities to prepare them for national registry.
Which led into my next question. What is the preceptor's role during the paramedic internship?
So, although we've pretty much laid it out there as far as the role of the preceptor, a lot of preceptors can sometimes feel during this course, some of them engage the student in report writing and things of that nature. So when we think about mandatory documentation for the program, it's continuing with the FISDAP and the paper forms. If the student has time and wants to engage in developing the report writing skills, that's okay, but it's not a requirement. So although in like a clearing process, although a lot of people think about that as part of a clearing process, that's an operational program expectation and not one of the academic or educational program.
Rob, can you describe what the expectations are of the preceptors and their role in the student experience in both field and clinical rotations?
So throughout our program there are specific expectations for each course, but today we'll talk about the general expectations across the board. First I'll start with our field preceptors. So for field preceptors, number one, they are extension of the classroom. Their role is to engage our student both actively during calls where they're assessing patients and performing skills, but also back in the station during downtime, reviewing paperwork, reviewing cases, protocols, medications, and so on. And the focus is that they are engaged in the learning process and there is a seasoned resource for them to use as they continue to grow and mature throughout the program. In the hospital and clinical setting, the preceptors are expected to also engage, but in a different way. In the hospital setting, they could be in respiratory or an emergency department or a NICU, and the idea is that the preceptor engages the student in developing their sense of awareness about those individual specialties, in addition to developing the assessment process and furthering the skill level of the student. This especially becomes true as they continue towards the end courses of the program, where we're really developing those critical thinking skills. But our preceptor is the tie between the classroom and the hands-on skill development setting.
Now that we've talked about expectation, what type of documentation is required to validate this process?
One of the biggest things that is required in any program is documentation. So for our students, we use the FISDAP online access, and there's also an app that students tend to use. The FISDAP program allows us to schedule shifts for students, track preceptors, and track shifts for them. It's a student's responsibility to take the information and skills that they perform in the field or in the hospital setting and enter that data and information into the system. This allows us to track the opportunities that they had, what they were able to fulfill, maybe look at any shortcomings, and be able to make adjustments in their clinical experience. As far as the preceptor's responsibility, when the students are in each individual setting, there's a paper document that needs to be completed by the student, accurately reflecting the skills, patients, chief complaints, and age groups that they're exposed to in that process. The preceptor then reviews the information in the form. They initial and sign that those skills were completed, essentially validating the information. And there is also a chart on the form where they can rate the student competency level, whether they need more skill development, whether they were pretty competent but maybe needed to develop a little bit more confidence, or the top level, which is they were confident and completely independent. So this provides not only the student real-time feedback during the clinical shift, but also we can reflect afterwards, not only with the preceptor in downtime and the program when we do clinical education meetings with the student.
What's the clinical scheduling process, and how do preceptors receive the information about their students?
As we think about the scheduling process, it's easy to break into the two separate areas. First is field scheduling. So field scheduling occurs with the individual operational programs that we have affiliation agreements with. And this can change from year to year and semester to semester. The important thing to note is that we have to have affiliation agreements with these operational programs. And they work with the clinical education coordinator to set schedules and assign preceptors that they vetted and support through the program. Depending on where the student comes to us from, some we have regular agreements with that provide us preceptors, and the student will schedule independently with them and or directly. There are other affiliates where they provide me available dates and stations, and I place that in the FISDAP scheduling for the student to schedule, and we coordinate where to report and who their preceptor might be for that day. So those are two distinct processes, and depending on the field vendor we're working with, it's one way or the other way. When it comes to hospitals and looking at different units, whether it's the NICU, emergency department, respiratory therapy, peds, and so on, those clinical sites, once we submit to them and they clear students to come, they'll provide us the dates and shifts that are available. The students will go into FISDAP, sign up for the shift, and we provide that list to the individual clinical sites so they know who to expect and when to expect them. And that's the general process for hospital clinicals.
What are some of the challenges that may be encountered by the student and the preceptor?
Typically tend to look at these in two different areas. The first is administrative. When we think administrative, those are things like our expectations for our students. So for example, all of our students from CCBC we expect to report to any clinical assignment professional. That includes their attire, complete professional uniform including their identification and a stethoscope, a professional demeanor. They approach the situation with professionalism, including their interaction with the preceptor, interaction with other hospital staff or other field providers, as well as the patients themselves. Any deviation from those standard expectations, whether it's tardiness, the student leaving early, the student demonstrating bad affective behavior, which is that professional demeanor and uniform, we expect to be reported back to the clinical education coordinator. It's important that our students are there ready to be engaged, just as the preceptors have taken the time to be ready and engaged with our student. On the other side of that coin are things like injuries, things that we don't expect to happen, but when they do, we also want to be prepared. If an injury happens to a student during the course of a shift, and it could be anything from an ankle sprain or a fall or a seizure to a needle stick. The first thing is to make sure that the situation is addressed immediately, whether they need medical attention, 911 gets called, or they get transported to a hospital. That obviously needs to happen first. As soon as it's appropriate and accessible, the clinical education coordinator needs to be contacted. That will start the internal process here at the college. As far as anything that happens in the field, once the student gets medical attention or any immediate concerns are addressed, there's paper documentation that needs to be filled out, which includes a first report of injury form, and then that gets turned in along with any documentation about the incident. On the academic side here at the college, it's just a chain of notification. When it comes to seeking treatment, a lot of times clinical sites ask about, well, who's a preferred vendor or who's insurance. So here at the college, our students maintain their own insurance. So any injuries sustained, anything like that, it's their choice where they go for medical treatment as per their normal insurance process. So now that we've discussed some of those issues or concerns that may arise during a clinical shift, although we can't predict all of them, there are always questions that arise from preceptors and sites and students. So if anyone has any questions as the program continues or through their stint as a preceptor, they should be directed through the chain of command to the clinical education coordinator. It's impossible to predict all questions and scenarios out there, and that's why we try to work with all our clinical sites and maintain that communication.